So Jenna, maybe just to jump straight into things, what was your professional and research background prior to starting your company? So like, what was the foundational knowledge that you're using and bringing into your company?
All right, so Glenn, I'd like to expand the question a little bit so that you understand the time and my own personal background. So I got my PhD in 1970. This was in the middle of the Vietnam War. And I had at that point two little children, one who was 2 and one who was 6 months. And we were moving to Bethesda because Bob, who's my husband, was going to be a yellow beret. That's how physicians could serve during Vietnam at the NIH. And the other thing you should know is that in my class, my entering class in graduate school, there was 10 of us, 9 men and me. So we were dealing in a very different era. And so my first few jobs were postdocs, part-time postdocs. The first one with Jerry Cornfield, who introduced me to Bayes and to lots of people at NIH. And then we moved back to New York, and I had a part-time job at Columbia. And then I was really fortunate to be hired as an assistant professor at Hunter College in the math department. And I taught statistics for 7 or 8 years and loved it. And then had the opportunity to become the branch chief of the Biostatistics Research Branch at NHLBI, National Heart, Lung, and Blood Institute. Bob left his position as a physician at Memorial Sloan Kettering, and went back to the NCI. And so then I had 7 years of wonderful experience at NIH, dealing with clinical trials, dealing with issues in monitoring of clinical trials. And so I would have spent my whole life at Hunter being really happy teaching. I would have spent my whole life at NHLBI being really happy in the branch. But then Bob decided to leave NCI again and go up to New Haven to head cancer drug development at Bristol Myers, and I followed him. And a year later, we moved back to Bethesda. He went back to the NCI, and I was unemployed. So that's the background at which something had to happen.
Cool. And so then from there, what was what prompted? So I guess that explains why you were essentially a lady without a space. And so from there, what was well, actually, let's circle back there though. What was your sort of research interest still? What was the thing that you really want to continue to focus on and preserve wherever you went?
Yeah, well, it was methodology of clinical trials. That had not been I had started more in statistical epidemiology, but the NHLBI experience really made me love clinical trials and methodology of clinical trials. So that's where and also my work with Jerry Cornfield had to do with that. So that's where I was going professionally.
All right, cool. And so so obviously, you could have also Bristol Myers, I believe, does clinical trials. So there are other drug companies out there. What was it that prompted you to start your own business? And also, was this the business that ultimately became the one that we're talking about, or was this a transition or a first start? But first, what was it that prompted you to start your own business as opposed to just burrowing into a local university or a local drug company?
Well, first of all, there's very few local drug companies in DC, but what happened was we came back from New Haven after a year, and I was offered a bunch of jobs, but all of them, remember, I had left Hunter tenure, I had given up tenure, and now I'm offered 8 years later a bunch of jobs, none of which was exciting enough for me to have said 8 years earlier, oh, I'll give up tenure for this. And so Bob said to me, look, you've moved twice in a year. You have piles of papers that are not finished. Just finish your papers and something will happen. So not long after that conversation, I got a call from Jerry Sadoff, who is the head of immunology at Walter Reed. And he's somebody I had known from my NHLBI days. One of the things that was really important to me was during NHLBI, those days, I met lots and lots of people. And Jerry called me and he said, "You're unemployed. How would you like to learn about malaria?" And I said, "Oh, that sounds really interesting." And that's how I started. I started with a call and no background really in malaria, no background at all in malaria, but it sounded really interesting. And that's how I started.
So I guess that answers who your very first client was. But more generally, who were your first like cohort of clients? What theme did they have and things like that?
Well, that's an interesting question. They came from different parts of my life. So I had a very early client was the Department of Agriculture, which was then interested in what was the effect of trans fatty acids on lipid levels in people. Remember, this was a long time ago. This is 1991-ish.
Before potato chip bags were labeled with trans fat and things like that.
That's right.
All right.
Exactly. And it was not known what trans fatty acids did to lipid levels. And that came through, remember, I'm at NHLBI, had been at NHLBI, which worked a lot with the food part of FDA, which also worked with the food part of Department of Agriculture. So that's how that came. And then I got a call from Jesse Cedarbaum, who was the chief medical officer of Regeneron, which was a very tiny company at the time. He had been sent to me by my friend Jonas Ellenberg because they were starting a study in ALS. And so he asked me whether I would consult with them. And then there was another call later on, we got a little more mature, from Ed Lakatos, who was then at Searle. And they were doing a study in heart failure with spironolactone. And he called me and he said, "Look, Janet, you know about DSMBs. A lot of industry doesn't do DSMBs, but would you do the DSMB for our RAL study?" So it came from various people, with all of whom I had been connected with in one way or another. And we formed, it was like, oh my goodness, we have a company, we have a group of projects that are really interesting and that we have the ability to do. But it was unplanned. It was all people calling and my saying either, "Yeah, this is interesting, we can do it," or "No, this is not something I know about."
Cool. And I think that is probably a good transition point to, in our previous conversations, you talked a lot about the values that you wanted to instill both in your company now and leave into the future. Were those values that you talk about, one, maybe we should enumerate those values, and two, were the values that you wanted something that were there from the beginning, or did they evolve over time as you had a better concept of what you wanted to be doing, both with your time and sort of your scientific output into the world? So maybe just to begin, what were the values that you think are useful?
So in the beginning, I didn't have a set of values written down or established. But it was clear to me that what I personally wanted to do was work that I thought was interesting and important. And as we grew, it was important that whoever was working in the company should also find the work that person was doing interesting and important. So it may not have been what I thought was interesting, but somebody else thought was interesting, but you should be working on things that you really cared about. It was also very important, and this was true from the beginning on, that we be honest. That if we knew how to do something, we should say we did. If it was something that we didn't know how to do, we should say. If we made mistakes, we should tell people. We should be really cooperative with each other and with our clients, and that's the name collaborative suggests that, but that also there should be initiative. Everybody should feel that if they see something that they want to do, or want to learn something, they should have the initiative to do it. So it was that combination of honesty, of cooperation, of care in their work, and initiative that were the values that we considered important. They became not stated in the beginning, but became articulated over time.
I just have to wonder, out of interest, because obviously there are projects that you find interesting, and as you said, there's projects that other people find interesting. What was sort of the most like orthogonal project that it was like, you might even think like, man, I don't understand how anyone would find this interesting, but someone else is like, this is my deal. I want to do this. What was the span of projects and interest?
That's an interesting question. So, I didn't find things interesting that were Me Too drugs for diseases that had already been studied. Or I didn't find that interesting, but other people did, because they said, hey, if we can have a drug that is easier to take or has fewer problems, that's an interesting problem to me. Also, there are areas of statistics that I don't relate to very well. I'm not very good at dealing with, so it's not a question of not interested, it's a question of not being good at correlational analyses. It's just not been my strength. And so when things came up like that, somebody else would say, I really like this. On the other hand, there were certain areas that I really like. I mean, I really liked working on vaccines. Other people don't. And again, I felt it was important that people work on the things they like and they find interesting, because then you'll work really hard and you'll think about it. And if you have to do something that you just don't enjoy, you're not going to spend the emotional and intellectual energy on it.
Yeah, that's interesting. It actually reminds me of a bit where, because I do patient vital sign monitoring, and you says I really like vaccines, and it reminds back to the one vaccine trial that I did actually with Andrew Pollard, where I was doing this post hoc analysis on reactogenicity of temperature in infants to vaccine, and it was one that they were busy phasing out, and they're trying to understand essentially, did one vaccine versus the new one have more reactogenicity, more adverse effects? And man, that data was just ugly. Like, man, I hated that data. It had a few interesting things in it, but overall, it's like, that was not fun, interesting data. But anyway, I soldiered on and did my job. But it is interesting how even within what might be considered a fairly narrow field, there's certain aspects of the data that just fascinate some people, and other people just say this does not lend itself to the type of analysis that I enjoy doing and things like that. It doesn't, maybe the type of discovery. I think that's probably a better way. What they're discovering from the data is not as of interest to them. And then that sort of hobbles their ability to, do their analysis as well as a hyper interested person.
I'll tell you something else. I love studies. I shouldn't admit this. I love studies with missing data, because that's really challenging. I kind of am bored by studies that are done. I love designing studies to make them do well, but then I find it very boring to analyze, because you know exactly what to do.
Yeah, well then in that case, continuous patient monitoring would be your dream world, because obviously no one can get continuous patients across, like continuous monitoring across all interested vital signs and physiology at every point in time. It's there's not enough goop in the humans to do that. But yeah, cool. So back to the question of these values. You talked about how things are interesting. Was there any evolution in those values over time, or was it pretty much what interested people and they found value in?
I think that's how we stayed. Mm-hmm. I mean, it was actually one of the reasons people like to stay. We had a system where if a new job came up, we had a spreadsheet, and whoever the job came to would describe the job, and then everybody would score it. And you'd score it on a scale of 1, which means if you give me this job, I'm going to quit, to 5, which was, I really want it. Please give this to me. And then that was one score. That was a score of interest. And then you had to say when you could actually do the job. Because very often people were too busy. There's something really interesting to them, but they're too busy to do it. But we felt that it was important to get to separate the ability to do the job in time from the interest. Because if we collectively understood the company's interest in kind of jobs, we would know what to be looking for. And if we only found out whether you could do it, we would never know what kinds of things to go for.
That is interesting. So it's essentially a tactic not only to keep people happy, but also to triage the work in a way.
Yes, that's exactly right.
Cool. So you're now talking about, obviously we're talking about people, and people take money to hire. So there's obviously the financial sustainability aspect, and is the company self-sustaining? And since obviously we've had some previous conversations, I'll ask this in 2 parts. How long did it take for the company to become financially self-sustaining for your other employees? And then how long before it became financially self-sustained for yourself?
All right. So for my other employees, I always paid them. I mean, that was part of the deal. The company, the employees changed over time. In the beginning, remember those 2 little children who were 2 years and 2 years old and 6 months. By the time I started the company, they were out of college, and I hired their friends. It was called the Kid Connection. So their friends coming out of college didn't know what they were doing, and we were really a tiny little company, and we just hired them, and we paid them, and we always had enough money to pay them. As we grew and we got more people who had some experience, we also paid them. We gave them salaries, and I paid them. It was always enough to pay them. What I didn't know was that I was supposed to pay myself. And what I couldn't figure out was, okay, so at the end of the year, I'd look and see how much money we had, and I would take it. So one year there was $40, and one year there was $120. And I thought, this is a little crazy that I'm working so hard when I'm hardly getting any money. And I hired then a person who ran, whose company was going to run companies' businesses. And the first thing she said was, Janet, I don't see any salary for you. And I said, I don't think I'm supposed to take a salary. I just own the company. And she went, oh, no, you're supposed to take a salary. And that's when I realized, oh, when you run a business, you have to have some plan for the finances. I had no plan. And that's when I learned. So I guess it was about 3 or 4 years through that I began to take a salary and to realize that we have to figure out how much money we're going to be earning during the year so that we can function. I never took a loan because I was too scared of owing money. But I was very fortunate because the 2 older children weren't in college anymore. So we only had 1 tuition to pay. And so I didn't really have to earn money. So I wasn't in the position that the money mattered. All I had to do was not lose. And so that was a very fortunate aspect of starting the company.
Yeah, cool. So if you don't mind, just a few more specifics on this, because I think that people would be interested. So essentially, maybe in the first year or first 2 years, just to keep in that time window, how many employees did you have, and sort of how many customers or clients did you have? I'm just curious about sort of like that ratio of.
Yeah. So we probably had 3 or 4 clients in the beginning, and we started with 3 to 5 people. We probably went up to 12. By the time we had 12, we probably had about 10 clients. So it was pretty small. Mm-hmm. The other thing that I felt, it was very clear that business was just going to keep on coming, that what was most important was to hire people and trust that business would come. And so what I was told later by people who know how to run a business, no, Janet, you're not supposed to do it that way. You're supposed to get the business and then hire. But that seemed to me backwards, because how would we know who could do the work if I didn't have them on staff? So I just would hire, if somebody really good showed up, I'd hire the person and then hope that business would come. And every so often I'd come home and I'd say to my husband, oh, Bob, we have all these people to pay and I have no work to do and I don't know what I'm going to do. And the next day I'd come home and say, oh, we got too much work to do. I don't know what to do. But that was the pattern. And I still think that's the way, the kind of business I'm talking about should run. I really think what's most important is having good people. And if you have good people and you do good work, the business will follow.
How many sort of support staff to statisticians are you talking about when you say we have 12 people? You mean say like 10 statisticians and then 2 support staff, or are you just chock full statisticians?
Well, in the beginning, we just had people. I would say as we got more mature, we have, so probably half of the people are statisticians, masters or PhDs. And then the other half, as a quarter, would be research assistants who do support in all kinds of ways. And then the other quarter, back office people who are doing the business and the record keeping and the billing and all of that. So that's been the split. We also haven't made, and this I've been told it's completely wrong, we don't have a real separation between statisticians and programmers. One of the things that has always bothered me when I was at NHLBI and was I would see people who were doing programming who didn't really understand what the study was about. That made no sense to me. And so our statisticians, there's this sort of a range. The most senior of it, I'm not allowed to program anymore. The staff told me, you've got to stop, Janet, because I was still programming in SAS 5. But that my belief, and I think the senior staff shares this, that people who are doing the programming really ought to understand the statistics that they're programming and the study that they're programming for. And so we've never had a very clear separation between who's a statistician and who's a statistical programmer.
Yeah, on that note, and the SAS question obviously sort of highlighted this as well. Given the duration of your company, what was your sort of technological stack, if you will, from the beginning to now? Essentially, obviously there's SAS on one end, and now there are a large number of open source statistical libraries. What was that evolution like?
Okay, well, actually the evolution in the beginning, I couldn't afford SAS. So in the beginning, we were doing things in Excel we were doing things in all kinds of tiny little programs. Quickly, I bought SAS. So probably within the first year, it was like, we can't operate on our fingers. So we started with SAS, only with SAS. And then over the years, as SAS changed, we did some S in the beginning, S plus early on. We've done some specialized software. And then of course now there's much more R. So it's evolved over time. And that's really been important. I always said that we should always be kind of almost at the cutting edge, but one step below, so that we're not running into programs that then turn out to have errors. But we're still mainly SAS because of the regulatory, all our regulatory work, but more and more are for certain kinds of modeling and certain kinds of graphics. And also people coming, kids, I shouldn't use the word kids. People coming out of graduate school are almost all doing R, and they're not, and that's what they want to do.
Mm-hmm. Yeah. So obviously, like, is you reach an interesting stage in your company when you can afford SaaS. So obviously, the companies have these different stages. I was wondering, were there any special challenges at different stages that you would not have noticed or anticipated before? So, for example, just starting out, a lot of people are worried about whether or not they'll have clients. It sounds like you were fortunate in that regard. But what were the different stages and the different challenges? For example, you mentioned before that you didn't want to do, not in this conversation for those listening closely, but in a previous conversation, you mentioned that you didn't want to do data management and things like that. What were those challenges?
All right. Well, the first challenge was, what should we do? Right? It was, and when I told you before that I didn't want to do data management, that was because I considered, and I still consider, data management incredibly difficult. And I felt that if we did it, that I would not be able to leave whoever was doing the data management alone. I would get involved, and I didn't want to do that because I wanted to do statistics. But in the beginning, we were kind of experimental. Okay, we'll take this kind of job. Is this kind of job something that we're good at and that we like? Or is this really too far away from what we know? We did dip into data management with some small studies and realized, no, this is not what we're good at. So we learned, we developed expertise over time, and we learned what we were good at and what we weren't. And we broadened, I would say, we broadened the areas of our therapeutic areas. That broadened and broadened. But what narrowed was the statistical things that we did. So we do a lot of data monitoring committees. We do a lot of one-on-one consulting. But that one-on-one consulting is mainly moving from phase 2 to phase 3 or doing phase 3. We do very little phase 1. We tried it, and it wasn't, none of us was particularly good at it or had the right kinds of insights. So that was kind of, over time, it's like steering a ship and getting into the right groove, or the right current, I should say.
Yeah, that is helpful. And it is always interesting to hear how, people do learn and evolve and grow their skills over time. But they also, part of that growth process is understanding what to avoid. It isn't just that, you're not like the blob from the horror movie where you just keep consuming things and getting bigger and bigger. It's, you know what you can eat, what you can't, and you evolve that way. And I guess that aligns very well with your company's value of making sure that you're working on things that you can do and that you're interested in. Cool. So, I guess maybe this is actually a good transition to the topic of statisticians as entrepreneurs. So, you previously you've heard my my theories on this and sort of how there's a tension between the sort of the benefits of being a professional statistician or data scientist and the challenges of being an entrepreneur. So, and my thesis on this is something along the lines of, statisticians were very comfortably paid. We have very comfortable jobs. Those jobs rankings that they always show, that the ASA always puts up, saying, "Oh, how great it is to be a data scientist or a statistician or mathematician." Our jobs are fairly cushy, fairly stress-free in most scenarios, and very well compensated and well respected. I think the social status and the respect that comes with being essentially a mathematician and a scientist has a lot of social gravity to it. So there's a lot of benefits with that. And to leave that position creates an opportunity cost. Essentially, yeah, well, it creates an opportunity cost. But to become an entrepreneur, you are walking away from that comfort zone, that traditional comfort zone. And you're taking risks where you wouldn't need to take risks as a statistician. So it seems like there's some tension between the benefits of being a statistician, a professional, day job statistician, and starting your own company. What is your opinion on that?
So that's a really complicated question. I think we're going to answer it in three ways. The first is that although I told you I love teaching and I loved being at NHLBI, I hated bureaucracy. And it just drove me crazy to have to fill out forms that were obvious. And it drove me nuts. One of the first things I remember happening to me when I started Statistics Collaborative is I wanted Mongol pencils. You probably don't use pencils anymore, but I love Mongol #2 pencils. They're my favorite kind. And when I was at NHLBI, I couldn't have them because they weren't on the requisite list. And if they were, I would have had to request them in triplicate. And now I could just walk to the store and buy them. So that was liberating, all right? The other thing was my husband always said to me, why don't you start a company? And I would say, why should I start a company? I'm so happy doing what I'm doing. And he would say, but you like to do all kinds of different things. And you could do that if you were in a company. I don't want to do that. My brother, who was in mergers and acquisitions, always told me start a company to start. And I would say no. Later on, when I went to him and I asked him, Danny, why did you tell me to do this? Because I really love it. And he said, because I know you like to take risks, which is something I'd never thought of myself. But I realized that having a company is constantly taking risks. It's making decisions. Should I buy SaaS when I can't afford it? Should I hire this person when I don't have a job for this person? Should I tell somebody I can't do this because I don't know how to do it and therefore they'll never come back to me? So it's risk after risk after risk. And you just have to not even think of it as a risk. And I've had other statisticians say to me, I wouldn't do this because it's too risky. So I think you have to understand your own level of risk. And when when I took one of those risks and it was like renting office with many more offices than I had people. It was like, I'd rather do that than have to move when I have enough people. If you're the kind of person who's going to be eaten up by those risks, by those decisions, this isn't a good thing for you. But if it doesn't bother you, if you just say, well, this is what I'm going to do, and if it's right, it's good, and if it's wrong, well, I'll do another thing, then it's very exciting and very much fun. But one more thing, and I said this before, I didn't have real financial risk because if I failed, we would still have food on the table.
And fine paintings in the background.
The tuition,
okay. Oh, so and fine paintings in the background.
And fine paint, yes, yes.
Cool. Yeah. Did you hit all three of the points that you wanted to? I lost count, but you said you wanted to enumerate three things.
The pencils, my husband and my brother.
Okay. So the #2 pencils are an actual point.
Yes, right.
All right, cool.
Yeah, because it showed the independence that you have, that you can define what kind of bureaucracy you want to put in and what kind of bureaucracy you don't.
Mm-hmm. Well, I think it's interesting, and maybe we'll wrap up on this point. But you had mentioned before that you had a colleague who I believe ran a dance studio, or was it a retail thing. I might be conflating stories.
A retail thing.
Yeah, it was a retail thing. Yeah, sorry. Yeah, the one that I related to was this person who owned a retail dance studio. But it was the idea that very frequently when you're a business owner, you will actually find yourself relating more to other business owners across professions or across domains than you will actually, fellow statisticians who aren't in a business ownership, aren't in an entrepreneurial or essentially this higher risk scenario. And I think that's an interesting point. Do you want to highlight any of that?
Sure. So her name is Betsy Fisher, and she had a store in DC called Betsy Fisher, and that's where I bought all my clothes. And she and I would talk over the years about the problems and the fun things and the difficult things about running a business. And they were very similar. It had to do with staffing. It had to do with the level, how can you control and not control? How can you delegate and feel comfortable delegating? All those issues. And also the risks. One of the things that she did, very interesting later on, when COVID came, she closed her store, moved to Colorado, and she's now has opened a Betsy Fisher online. And so she took a really big risk, and it's been very successful. And we're still in contact with each other about changes and about decisions that we make.
Yeah, I guess it is nice to hear the successes, of course, but at the same time, part of the reason that there's this tension or this dissociation from people who aren't building their own businesses is that when we talk about risk and we hear about the payoffs, that's great, but sort of the visceral feeling of the loss when a risk doesn't go well. When you talk about coming home to your husband saying, "We have these people, I don't know how we're going to pay their salaries. They need those salaries so they can feed their families," and so there's a bit of a dissociation there between just describing it in the actual sentiment and the feeling, the subjective feeling of those types of things. Very similarly, when you talk about the challenges of finding good people, when a non-entrepreneur reads, for example, on LinkedIn or on the news that there's a job shortage or that people are finding it really difficult to find good technical skilled people, or even finding good like blue collar workers, it's, for many people, it's just a headline, it's just a story, it's just an interesting tidbit, like dinner table conversation. But for the people trying to make sure that their businesses survive, this is very visceral. You can feel it, and you can feel it across domains. A person who's having trouble hiring good, wait staff, you can feel it very much the same as if you're trying to hire a good engineer and you can't find that engineer who is essential to keeping your product moving ahead, or some discovery going ahead. So yeah, I do appreciate that. But yeah, maybe I'll give you the last word, and then we will go to the Q&A.
So you've hit on a really important point: choosing the right people, and that's a risk. Every time you hire, it's a risk, because you don't know whether the person in front of you that you're interviewing or whose material you're reviewing is going to be the same person when he or she is an employee. And sometimes there are surprises. Sometimes the surprises are positive. There's somebody that you thought, I don't know, we'll take a risk on this, turns out to be fabulous. And sometimes it's the other way around. And one of the hardest things to do, and I said I'm really easy about making decisions and so forth, the very most difficult thing is when you feel that the person you've hired is never going to make it. What do you do? How do you try to grow the person and identify the strengths so that you can keep the person? And how do you say, this is the wrong fit, and help the person find something that is the right fit? And that's always very hard, because you never know. There's a false positive, false negative thing here, and you never know what person you could have hired that would have been good and you missed, and what person you could have kept and could have held and could have nurtured and you didn't know how to do it. But mostly, I think it's very important that employees really understand how valued they are, because a company like ours could not function without people who are terrific. And with that, I welcome questions.